My name is Dr. Devan, Professor of ENT in the AJ Institute of Medical Sciences, Mangalore. My talk this morning is my primary concern about the hundreds of dengue cases which are happening.
World Health Organization is warning about a dramatic increase in dengue fever around the globe.
ರಾಜ್ಯದಲ್ಲಿ ಡೇಂಜರ್ ಡೆಂಗಿ
ರಾಜ್ಯಕ್ಕೆ ಡೆಂಗಿ
ಡೆಂಗಿ
Today it's the most important epidemic disease of humans.
It is so sad and stressful, and it is so concerning because this is something that should not have happened. So many cases of dengue. Do you know, around the world about 300 million cases are happening, and in a year about 20 to 30,000 people die. Why? Because we are bitten by a mosquito that transmits the flavivirus. It just should not have happened. That occurrence and the widespread occurrence reflects on the very civic functions that are happening. Now, what can we do on our own as an individual? Precious little, nothing you can do. The only thing is protect yourself. How do you do that? Now, a little bit of a time, mosquitoes are not, as we thought earlier, attracted by blood. They are attracted by the human sweat smell. Some people are a little stronger than others, and they attract mosquitoes by the drug. What can you do? What do you mean by a deodorant is what covers your smell. Earlier we talked about odomas and things, but now I know. Now let me make it very clear. The views that I express are entirely my own. What can you do? What do I do? I am terrified. One mosquito bite and your passport, or make it clear, your visa to exit Earth can come. How many people die from malaria, from dengue? I won't say dengue, but dengue, and of course the terrible suffering of chikungunya, and earlier in Mangalore the extraordinary huge elephantiasis and filariasis. It is up to you to protect yourself, because the civic authorities seem to be doing, they do try, but they are doing precious little. It is high time something on a war footing and wipe out the mosquito menace, but that may not happen in the near future. So, having realized that the mosquitoes are primarily attracted to the human sweat smell, I started advocating what is a deodorant, something that you spray on yourself to mask the sweat smell. Spray yourself a deodorant when you get out of your house. But what about your home? Protect your home by a mosquito mesh. Even one mosquito inside is danger to you. Please realize that people are dying. We lost our department receptionist due to cerebral malaria, and so many people are dying. You got to be really, really careful and be concerned, because this is something that you got to be really be aware of. So, when you're getting out of your house, spray yourself with some deodorant, whichever is your choice and which you can tolerate. Do I have a choice? I spray the Brute, which I really like and which is strong enough, and I find they don't attract mosquitoes anymore. The fact that we have survived here for more than 3 decades in the midst of all this terrible scourge that is happening, perhaps is a testament that it works. And to all those who come to me, I tell them, spray yourself something. Absolutely make sure where your arms, legs, where do mosquitoes bite, where it is absolutely accessible. That is this is called the pinna, the earlobe. They will come and bite here. You may not be aware. 3rd, 4th day they will develop terrible fever, terrible pain behind your eye, and then extraordinary body pain. Then it comes down. A couple of days later, it suddenly shoots again. Oh, you are in big trouble. And then sometimes your blood platelet come down so badly. When it comes to 30, 40,000 from 150,000, you will start bleeding, and eventually, if it is really critical, people will die. So, therefore, one bite can kill you. Consequently, take absolute care. You got to be really, really careful. Take the precaution and care that when you come out of your house, that's what I do, that's what I advocate, and all those who are strictly following, they seem to be pretty safe. Just spray some deodorant on your body, arms, legs, and on your ear pinna, so that you are not bitten at all. The moment you find, because it takes a couple of milliseconds for their saliva, the mosquito to go in, and then when they suck your blood, the moment you feel you are getting bitten, swat it, kill it. Is killing a crime? In this case, it is not, because you are protecting yourself. That is one. Second, when the virus gains entry, what can the body do? Can we give an antiviral drug? No, we don't have any drugs. We can only take care and give in fluids, and of course caripral tablets are there. But then Is the body having a natural antiviral drug? Now I repeat again, these views that I am expressing are entirely my own. Once upon a time, we felt that we are going to finish off viral diseases because of the drug called interferon that the body synthesizes. But then that did not get anywhere. We could not synthesize properly, and it was. But then the body can generate it. How? By ascorbate. Now, what is a great tragedy about the human being? Now, be careful, be cautious when you listen to me. The human, we are mutants. Mean one particular enzyme we do not have and cannot synthesize ascorbate. How do animals have it? Of course, yes. They are protected by the divine universe. They have gluconolactone. They synthesize ascorbate, and when they are in stress, it goes up to 3 to 5 to 6,000 milligrams. We don't even manufacture even 1 milligram. We cannot. We are defective in that. Even though 300, 400 processes are required for ascorbate, we cannot synthesize, which is why humans are suffering so much. Ascorbate or ascorbic acid is a vital ingredient that I do not know why humans have been constructed, or along the way of our evolution, we lost the ability to synthesize ascorbate. So anyhow, come back again. Those whom I have come across suffering from dengue, I have given ascorbate to 2 tablets thrice a day. By the 3rd day, they are out of it. It vastly enhances interferon production in the human body, and it increases the platelet count also. It reduces the fragility of the vessels. Otherwise, when the vessels are fragile, when there is a tiny break, they will bleed. You do not have enough platelets to block that bleeding, they will bleed from all over. Whereas when you give ascorbate, it completely enhances the fragility and your blood vessels are stronger. Even though your platelets are, so whomever I have treated, by 3rd, 4th day they come out of it. Whereas if you don't treat, studies show it goes on for about 8-10 days. All that you can give are antipyretic drugs to reduce the fever and fluids to maintain and all that. So 2 things. Of course, there is a dengue vaccine, but then there was more suffering. In some countries, they have banned the vaccine. It is no longer found to be efficacious. So, you are the captain of your ship, master of your destiny. You have to protect yourself every time. Till this dengue is an endemic here, 1 bite can finish you off. So, therefore, protect yourself by some deodorant which you feel is strong enough and which will not attract the mosquito. Number 2, if by chance you are having an infection, then I am not advocating to other doctors. They are wonderful. Doctors are the greatest brains that the society can ever have. To become a doctor, how long and stressful and painful and difficult it is, and they have to be kept on the highest pedestal because society survives primarily by the excellence and outstanding intellectual comport of doctors. So they have to be deified. What did Hippocrates say? Look after doctors and their families. So therefore, doctors are mankind's blessing. So again, I'm not there. This is my personal opinion that 3 times a day, that's what I have done to my patient. By the 3rd day, they are almost out of it. It works like magic. Unfortunately, we cannot synthesize ascorbate, which is why we need to give. And these are 2 things I want. Are there people who are resistant? Well, new studies show that it seems the vitamin D has some protective role, plus your immune system. What is your immune system based on? Iron, folate, B12 and zinc. Zinc is now known to be the cornerstone of immunity. Do we have adequate levels of zinc either in our diet or in the body? We have precious little. I did an initiative study looking at tonsil patients. Why some children have recurrent tonsils and others don't? To our surprise, Dr. Karthik, who is the head of department in Bangalore, he is the one who did that work and I was there to guide him. And we found those who had frequent tonsil infections were low in zinc. Zinc has an absolute protection for the immune. So make sure you will find on the zinc-rich foods, especially dry fruits and beans, all have rich. Make sure that you are replete with zinc at the rate of about 80 nanogram per deciliter, or 8 nanogram per deciliter is what you are supposed to be intaking. And make sure zinc, iron, when you have enough phytates in your diet, your iron absorption will be blocked. So make sure you have iron, folate, B12 and zinc. Now we now realize another important ingredient which we all had was vitamin D. Today our exposure to sunlight is almost nil. We from the house get into the car, get into the office. Whereas earlier, for thousands of years, vitamin D and sunlight was crucial to our survival and recovery. Today, everybody is vitamin D deficient. your vitamin D level should be 80 nanogram per deciliter. We randomly check. People will have about say, 20, 25, 30. No, it's not enough. So if you are deficient, vitamin D rich foods or vitamin D tablet to be taken once a week, at least 20 tablets a year, will make sure that some amount of resistance, because who knows, sometimes if you are bitten, your innate immunity is the one that can protect you. After all, life is a journey in which you have a lot of responsibility. Suddenly something happened to the breadwinner family. How tragic it is for the family to be shattered. So it is your responsibility to take care of your health. Therefore, protect yourself by enhancing your immunity. Now, don't self-medicate. Your family doctor is the best knowledgeable person who can guide you on all that. He is highly knowledgeable and who knows how to enhance your immunity and how to treat you too. And therefore, no, don't try to self-medicate and write your own drugs. No, these ascorbate, which I said, I have treated them. I have vitamin C, 2 tablets 3 times a day. By third day, they're out of it. So your family doctors are the most knowledgeable of the lot, and repose your faith in them. Be gratuitous to them, and wish you all the best. Survive the dengue epidemic which is happening in this part of the country. Thank you. Wish you good luck. God bless. Thank you.